Welcome to the Taylor Method for Pain-Free Living, a podcast that features enlightening conversations with experts in the medical field that helps to improve the health and well-being of those suffering from chronic pain due to injury. Learn from leading authorities the questions you should be asking to experience pain-free living. Hosted by father and son, Dr. Derek Taylor and Dr. Hudson Taylor, and joined by industry professionals in the health field, including doctors of integrative medicine and personal injury attorneys. Enjoy well-rounded and informative conversations to help you get out of pain while achieving optimal wellness. Dr. Derek Taylor and Dr. Hudson Taylor are the doctors of Taylor Chiropractic and Laser Center in Florida and California. Both father and son duo have earned respect and a solid reputation for successfully helping people transform their lives by assisting them to discover the hidden causes of their painful health challenges, leading them to experience the resolution of their problems using the Taylor Method. Tune in each week to learn about the Taylor Method, Dr. Taylor's proprietary technology that looks at the whole person and identifies the root cause of pain while facilitating natural healing and helps to restore the body to optimal wellness without using drug injections or surgery.
Welcome to the Taylor Method for Pain-Free Living podcast. This is Dr. Derek Taylor. I'm here with Dr. Hudson Taylor, and today we're going to be talking about a subject that is very near and dear to us, a subject that we have people come into our office all the time for looking to avoid the surgeries on this area, and that is knee pain. So knee pain, when I graduated from school, there was not much taught. That was back in the early 90s, 1990 to 93. We just were told with knee pain, refer people to the orthopedic surgeon. And they may have talked about adjusting, but that's about all, that there wasn't much you can do for knee pain. Now, Dr. Hudson, you graduated a few years later than I did. Were they teaching that same? Were they giving that same model or telling you that same message when you were in chiropractic school, or did they progress and advance in the topic of knee pain? What were you taught when you were in chiropractic school about knee pain?
Well, we learned essentially the same thing as you. If there are any positive orthopedic tests on the testing, there's any sort of suspicion whatsoever of some sort of arthritis or a meniscus tear, etc., refer them to the orthopedic surgeon. Yeah.
Right. So you basically were taught the same thing there.
Right.
Okay.
So, but I mean, we learned how to adjust the knee. We learned how to do an adjustment on the knee, and we learned to. That's pretty much it. That's pretty much all we learned.
Yeah, and we learned about adjustments too. But what I think what you and I have discovered over time is that the adjustment is just such a small component,
right,
to resolving knee pain, because you're dealing with all the soft tissue issues. With the adjustment, you're dealing with hard tissue. You're dealing with the joints, the bone is maybe misaligned, you're putting it back in place. But if you don't address that soft tissue issue, the scar tissue that's surrounding that knee joint, it's just going to slip right back out of place again. Have you found that to be true yourself?
Absolutely. Yeah. And in some cases, especially in the older patients with the fragile knees, it's not safe to adjust a patient. It's not safe to do an adjustment on their knee, Right.
Yeah. Or you're going to there are docs that maybe specialize when all they do is adjust the knee, and they're going to have a higher skill set than somebody who just doesn't take much time adjusting the knees. But still, even you could be the best adjuster in the world, but if you're not addressing the deeper underlying issues of the adhesive scar tissue that's affecting the quadriceps muscles, the hamstrings, the peroneal muscles, the calf, the glutes, the hips, even the back, you're going to be missing quite a bit in your quest to resolve knee pain. And it's pretty prevalent. I mean, knee pain is pretty common especially in the aging population, people wear and tear their knees out. Maybe they ran cross country in high school, or they're a jogger. They've been a jogger all their lives, especially those that have been joggers all their lives. Or they're just been active, or they are court players. Think about tennis players, banging, boom, 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 boom. They're just like short, high impact chops and steps to that knee. What happens to that knee?
Yeah, right. Starts to totally break down.
Starts to break down, starts
You
to wear
know?
out. That's when you have meniscal tears, you have
Mhm.
ligament tears, scar tissue starts to form around the muscles in that knee, and then pain sets in.
Yeah.
And then so those sports, can you think of any other sports that you commonly see in the office? Pickleball is a big one now.
Pickleball, and even golf. Even golf, because
Oh,
they're walking the golf course,
yeah. Well, all the twisting that's involved in golfing.
Yeah, the twisting on
You
the
have that
swing and
constant twisting on the knee, and that's where the shearing tears occur in the meniscus, and it just fragments those. And then, they're looking at getting some type of surgery, whether it is something minor like a arthroscopic surgery,
yeah,
and to a something greater or of higher degree. So,
right.
and then
Right.
of course, you think about all the high school sports: football, basketball, volleyball,
Mhm.
softball. All of these are going to soccer. All of these are going to have cross country track. I mean,
Yeah.
these kids are learning these things here, and they're going hard. They're competing, and that's where often the scar tissue sets in. And they have a little injury that they had, and they totally forgot about that. But now, years later, a decade later, even two, maybe three, now they're playing on that again, and that's starting to manifest and show itself up. And then they have the pain that sets in, and they're like a perfect candidate that sets them up for some type of medical intervention. And when people come in, they're not always keen on receiving an injection. The most
Mhm.
common injections, of course, are the cortisone shots, and that the reason being is because insurance companies pay for that. They'll gladly pay for that, so their insurance covers it. People come in all the
Mm.
time hoping that that little card is going to take care of all their health issues, but sometimes that can be pretty detrimental.
Mm.
Getting that
Mm.
cortisone shot, you might have some temporary relief, but it always inevitably shuts down the blood supply to that area, and
Mm.
it weakens the joint, and we will see the acceleration of that joint, the degradation of that joint over time just occurs that much faster. It's at an accelerated rate. When we take x-rays here at the
Mm.
office, we're always getting an AP x-ray bilaterally of both knees, and often I can tell, hey, did you either injured this one, or you got a cortisone shot in this one, or both, and it's often both.
Mm.
So it's funny, sometimes the area that's the most problematic, it looks worse on the x-ray, it's actually the opposite one that is hurting, that what brings them in. And
Mm.
why do you think that is? Why is it, if someone's got a knee that is degenerated, let's say on the right, but now they're having pain on the left, why do you think that is from your perspective, Doc?
Yeah, so we do the 3D alignment scan to see how they're standing. And we'll see that they'll have pain in the left knee, but on the alignment scan, they're shifted over and they're putting all their weight on their right knee,
Mm-hmm.
and it's often because the root cause of the pain hasn't been addressed. So the body's going to lean away and compensate away from the other knee,
Mm-hmm.
and put a
Yeah.
ton of strain on the other side. And then next thing you know, they develop the opposite knee issue too. So they're stuck with two knee issues. And as the years go on, it'll lead to bone on bone.
Yeah, and what we see often is that what I see often is, let's say they come in with left knee pain, even though the right one looks worse. what has happened is that right one was the one, if you always go back in the history, the right one was the one that first started bothering them. They started compensating, and those compensatory patterns kicked in, and now they've worn out the good knee, the left, and so that one's inflamed. But you still have a problem on the opposite knee. And what often happens is you fix the one that they originally came in for, that one clears up, and they're like, wow, my left knee's better, but now my right one's bothering me. Why did it transfer? Well, they were both occurring at the same time. However, what we learned in school, as you know, through neurology, the large diameter C fibers, they'll get to the brain first and they'll override the other pain fibers. And so that's the one that they'll feel the most. But once that pain is diminished and gone down, now this one will manifest. I always tell the patients, if you felt pain everywhere where you were problematic, you'd want to commit suicide because you'd be in constant pain all the time. That's a gift to not be able to feel pain everywhere, but just the ones that are most prevalent and override that gets to the brain. But that's what happens. That one, and now this one shows up.
Right. That's a great point.
So, but like you said, though, it's a lot of time it's the balance. So let's talk about foot pain. I mean, foot imbalances. How do foot imbalances cause knee pain? How would you answer a patient that asks that question?
Yeah, that's a great question. The feet, I would say number one, the feet are literally right underneath your knees. So your feet are the foundational supports for your knees. So I can't tell you too how many times you've seen a knee pain or a knee problem, and sure enough, they have had a past history of a foot injury or a surgery in their foot or a break in their foot in the past, or they have bunions on their feet or their arches are all compromised and collapsed. And next thing you know, they're having knee pain. Well, that's because if the support of the foot is messed up, then the knee's going to take all that trauma straight into the knee joint.
Right. And so that's why at both of our offices, one of the first things we do when they're dealing with knee pain is to do a 3-dimensional foot scan to see where they're putting pressure on which leg and which joint. And by doing that 3-dimensional foot scan, we're able to look and see if the arches have dropped or not in the feet. As there are 3 arches in the feet: the medial longitudinal arch, the lateral longitudinal arch, and anterior transverse arch are there. And often we'll see not just one, but typically 2 of those arches shot or gone, and 2 out of the 3. Sometimes you'll see all 3, and then then there's no wonder they have knee pain. But in that little scan, it tells us so much. You can see their pronation stability index, which should be between 0 and 34. Sometimes you'll see people in their 80s, 90s, 100 and 110. Some people, I just had a person the other day was over 150, and their feet were so flat. They were just congenitally born that way. But that puts an awful lot of strain on the knees, and the knees can never really catch up to those imbalances and those stresses that occur on them because those feet are so flat.
Right.
Which goes back to the importance of good shoes, right?
Yeah.
How many times have you seen where somebody's not wearing good shoes and the shoes that they're wearing is a contributing factor to their knee pain, right?
Yeah, all the time. All the time.
So their shoes, some of the biggest problems, what are some of the problems that you see with the shoes that they're choosing to wear?
Yeah, I would say either they're way too thin and too flimsy and too just, too much of an unstable support. It's like the patient's walking on a balloon, or a piece of rubber that just shifts back and forth, and it's so thin. So it's either totally unstable or it's too fixed to the point like where they're walking on cinder blocks, and their foot can't even move. They can't absorb the ground, and it's like all the force goes straight into the knee because the shoe is too hard.
Right. And that when that happens, that shoe acts almost like a cast. It totally, there's no flexibility with that. And then what happens is that knee has to work a whole lot harder and it starts to wear out and you start to have problems. And you can look at the bottom of the shoe, you can see that these uneven wear patterns. All you do is look at the bottom of your shoes. If we start to see one side wearing out faster, that's already an indication that you have some imbalances there that need to be addressed. And how many times when we start to not just work on the feet, but support them with properly fitted orthotics that are custom made for their condition, what a difference that makes with knee pain.
Right. Oh, totally.
I mean, how important, in your opinion, your professional opinion, is having that support underneath with custom designed orthotics to support those arches and resolving knee pain?
Oh, I would say it's absolutely crucial. It's absolutely crucial, especially for the people who are standing on their feet all day long or they're walking. Like I had a patient, she really wanted to go. She had a 3-day Disneyland trip coming up, so, aside from just treating her knee, aside from just treating her knees, her getting a great pair of orthotics, we prescribed her a great pair of orthotics. And as her knees got better, she started using those orthotics and just felt so much more stable. She had a great time at Disneyland, walking for hours all day long, all over the park for 3 days. And the orthotics were just really crucial for those moments. And she had a blast,
right? Or think about that patient who had that torn meniscus, and she walked to hike through Yosemite, right?
Right. She was using those orthotics.
Yeah. I mean, because that just supports the knee. So you can get a treatment. I tell people, look, you don't necessarily have to get orthotics. I mean, that's your choice. But you can get great results with the treatments that we do, and we're going to talk about that in just a moment. But if you're not afterwards, once the knee is fixed and that scar tissue is cleared and things are balanced, well, it's like wearing a retainer after you've gotten the orthodontics on your teeth and your teeth are all straight. Wearing that retainer to kind of help support it and keep it like that. If you go back to wearing the wrong shoes or your arches are not supported, eventually over time it's just going to accelerate that problem developing again, and then next thing you know, the pain returns. I had a patient, she was in her 70s. She came to see me. The doctor wanted to do a knee replacement on her. She had it was like bone on bone on the one knee, and she got a course of treatment. I think she did a care treatment over a period of like 2 to 3 months. Knee pain completely resolved, and she got orthotics. Spoke with her daughter, and over a year later, still no knee pain.
Oh, wow!
Would I be able to say that she still had no knee pain if she did not have the orthotics? I highly doubt it, just because there's going to be those imbalances and stressors. It's like, if you have cracks in your foundation in your house and in the walls, you have cracks because the foundation is off. Well, you can get some putty and mud and seal those cracks, sand it off and repaint. But unless you take care of the foundation and balance that out, that's going to continue to shift and those cracks are going to show up again.
Yeah.
Level the foundation, then it can stay like that. And that's what the orthotics do.
That's incredible.
So let's talk. Go ahead. You're going to ask.
I have a question for you. So what do you think about, bone on bone knees? I mean, that lady had success and didn't have any knee pain after the protocol there. So what's your take on bone knees? If someone has bone on bone knees, well, actually, let's maybe just start. Why do people get, in your expertise, what is one of the most common reasons why someone has a bone on bone knee?
Well, I have to think about the imbalances in the body. You're walking, there's a lot of pressure. That's all the weight of your body being the knees and the feet impacting that. And if your shoes are not right and you're not supported there, your knees are going to take more of an impact. And then you combine that with sports where they're running or stressing that knee, you're just gonna, it's like an eraser on a pencil tip. You're just gonna wear it out until that cartilage and that supportive structure is just worn down. Just like when people grind their teeth at night, those teeth get flatter. Well, you're starting to grind down that tissue because of those imbalances. There's other factors as well. We know that when somebody has a prior surgery, like an arthroscopic surgery, or they've had any type of invasion in that area, that area is going to accelerate in the degenerative process. Cortisone shots, like I've mentioned before, poor diet, wrong shoes, the sports, adhesive scar tissue, that is, everything's tight around that. It's creating that imbalance. It has not been addressed. And so things are just shearing and wearing down. And then, then you're looking at a bone on bone situation. But the beautiful thing is, even with bone on bone conditions, you see that bone on bone, and logically you look at that and you think, wow, well, the only thing that's going to fix that is going to be a replacement surgery. But it's amazing how the body works when you start to balance it out and you start to take off the stresses and deal with the cause, and look at the whole person, including, even weight. When people have gained weight, most people over a period of 5 years, they've gained another 10 pounds over time. Sometimes that's more. What does that extra weight do on the knees? Just little things like that. The diet that they're eating, that's huge. I mean, I've never,
Right.
You don't realize, people don't realize how big an inflammatory diet of eating processed foods and gluten and dairy and sugar and GMO foods and all these other things that are creating inflammation in the joints, and that creates more irritation to those nerve fibers that are being affected by that bone on bone. And that itself, so there's so many different factors. You just can't zero in on that knee only if you're looking at a holistic, natural approach to, resolving some of that. Now, there's a time and a place, I think, for a knee replacement. I'm not saying that it's not beneficial for people. And there are some people that have had the knee replacement and they're happy as clams and they don't have any pain. They're doing well. It resolved their issue and happy. I mean, it's worked great for them.
Right.
But what about the patient that it didn't work well? I had a lady come in. She was in severe chronic pain all the time, just because for whatever reason the surgery was not successful, and she's now in chronic pain. So I think that surgery is an option that may want to be considered as a last option, where you may want to try natural approaches first, to avoid that, because those surgeries also, I think they last about 20 years before they have to do a revision and redo it again. And you don't want to be too young in getting one of those surgeries, because if you have a surgery, knee replacement, let's say 52 or 55, and then it's 70, 75 again, do you really want to go under another revision at that time? And I've had some orthopedists say, no, there people say they've told me I'm too old to get one. It's just too risky. It's not worth it.
Oh man, what a nightmare.
And so, but there's different options. I mean, there's options out there. People just need to choose what resonates with them. But as for myself, I'm always going to want to try to keep all my original parts as much as possible before I start to quickly replace them, and hastily do that without giving it much thought about, well, maybe this knee pain is a body signal telling me that I need to clean up my act in other areas of my health, right? Those are all typically like hidden blessings, real life, telling you, hey, there's another issue here that maybe you need to address this. Maybe, and if you don't take care of this, maybe some other health issue may pop up, like this knee pain did, that, you want to take care of it and get to the root cause and nip it in the bud now, before, things progress in a bad way.
And I think another thing that comes to mind is a lot of unresolved knee pains too. If someone has a knee problem or a knee pain and there's nothing done about it, they don't heal, and they're stuck in that chronic painful knee, that greatly accelerates the degeneration of the joint, and that really leads to bone on bone much quicker.
Yeah. Think about their health too, how it starts to decline when they stop walking and they stop being active. And
they stop walking. Yeah.
Then that knee pain causes more stress. And
Yes.
that stresses out the adrenal glands more. The adrenal glands have been associated with knee pain. When those adrenal glands are stressed, it can often lead to knee pain. The muscles around the knees start to atrophy, and then that sets them up even for more knee pain. And then what about those knee braces? They're wearing knee braces, right? When you wear a knee brace, I think knee braces are fine when you're playing a sport just for extra protection and to avoid that. But it's not meant to be worn all the time because your muscles take a break and they start to atrophy. I think what is it when it's like putting it in a little mini cast when an area, a joint is mobilized, it starts to atrophy by 3% a day.
Wow.
Just a week, that's 21% atrophy of that joint.
Wow.
And it's just gotten weaker, and then it sets it up for perpetual knee pain and problems.
Right. And this figure or this image comes to mind. You've seen the knees, speaking about quad atrophy, where their knee looks like a bowling pin, right? The end of the bowling pin, or the foundation of the bowling pin is thick, it's full. That's their quadricep, their thigh, right? Mm-hmm. And then you get to the knee, and all of a sudden it shrinks right before it gets to the knee. All the thigh muscles have been atrophied. Mm-hmm. I've been noticing that more and more, almost like that bowling pin appearance, where they have a good amount of muscle mass, but right before it hits the knee, boom, it shrunk. Right. And usually those people that have that bowling pin appearance, like you said, they've had chronic stress, or they've had a ton of scar tissue, old injuries, past surgeries, and they've been in chronic pain. The knee gets weak. The knee gets weak.
Yeah, and people aren't working out with those leg muscles, and there's guys that like to work out, but how often do they neglect the legs because people aren't looking at the legs? They just want big biceps or broad shoulders, or develop chest muscles, but they neglect the knees. And you can look at somebody, and you can see and look at by the atrophy of the muscles around the knees that you can probably predict this person has some level of knee pain or discomfort, or they're set up for a knee injury. So, it all tells a lot. So now, in regards to the treatments, that we have a few more minutes left in the show before we need to get off. We haven't really even talked about treatments. Yeah. But one thing that I've just been so encouraged to see is when you remove that scar tissue with the different technology that we have that makes permanent changes in the muscles and the tissues, and helps the body make its own stem cells. It's amazing.
Absolutely. That's amazing.
when you see that, and it's amazing to see how patients are, even after a visit, they're like, wow, I can't believe that this feels so much better at this time. Right. And how quickly you can get results on that.
Right. It's like their knees. Oftentimes patients say, oh man, my knees, they just feel lighter. They feel light, and energized,
right.
Like the shackles have been taken off of them, They
need to understand, though, that it feels good right there at the time of the visit, but the older they are, the more degenerated it is, the poorer their health is. It takes a little time for these things to really kick in, and for the treatment of technology to do its work. That they have to be patient. You can see immediate results immediately after treatment, but usually the next day they're going to be pretty sore, or the next couple days. And but over time, it's like your investments that you do, and you don't touch those, but over time you just get upward slope and trending of, like, one day they just say, I just have no more knee pain. This happens over a period of time.
And thankfully, and I know you would say the same, but thankfully, we've been able to see patients, have a reduction in pain very quickly, but the best patients, who, in my opinion, who get the best results are the ones that, even when they're out of knee pain, they keep coming, and they make it a part of their lifestyle. We and those patients, where they just love to come, and they come once a week, and they make it a part of their life, and that's when you really see the best results.
Too. Yeah, it just continues
as far as them. just really taking the time to clear out all the scar tissue and just keep those knees as balanced as possible, those are the ones that stay the healthiest.
Well, people need to realize that you're doing things that are constantly going to be wearing down that knee and affecting it. So with those stresses, maintenance care, everything needs maintenance if you want it to look good, whether it's your lawn or your pool or your car or your house. What about your body? What about your knees? By maintaining that, if you can just do a little bit of easy upkeep, as we call it, is that worth it to avoid a knee replacement in the future, or even a relapse?
Oh, right.
You have
Absolutely.
to start all over again, and to do all that work. An ounce of prevention is worth a pound of cure. Some people think, oh, you just want to, make us keep coming back for the rest of our lives. No, that's not really the issue. The issue is once you've gotten to this place, then it's your choice. We always tell the patients, how long you decide to benefit from chiropractic care is always up to you. But we're just encouraged when we see people continue on the path that upward slope continues to go like this with their health, when typically when you don't, just a law of entropy and just the effects of the fall and just time, you start to usually go down more.
Right.
And then, it's a wiser way to go as far as upkeeping that, and then learning exercises and just continuing to improve on not just your knee pain, staying pain free, but other areas of your health that's going to keep you doing the things that you love doing most: playing pickleball, golfing, enjoying the grandchildren, going for walks with your spouse. How important, how valuable is that to you? And to be able to have the freedom to be able to do that, as opposed to being trapped in a body that's loaded with scar tissue and loaded down with stress that's preventing it from functioning the way that it could be, even in the later decades of life. So
right, absolutely. And in your patients, you have those patients who've taken the time to take care of their knees, and they have bone on bone knees, and yet they're golfing, they're going on trips with their family, they're walking around the block with their grandchildren, all with the bone on bone knee, and yet they've taken the time and the knees are balanced.
And you have to realize too, people need to realize, like that 170-something-year-old lady I haven't seen in a year, she still hasn't had any knee pain. But that lady, when I think about it, she's not a avid sports enthusiast. She doesn't go out for walks. She's not playing pickleball and stuff like that. She's more, she's not stressing the knee a lot, so the pain hasn't returned. But if you're in a type of person who's constantly stress putting, and you're in your 50s, 60s, 70s, 80s, and you're constantly stressing that, you're out in the garden all the time, you're always going for walks, or you're playing a sport like pickleball, it's inevitable. You're stressing it more than the average person. So maintenance and upkeep is a necessity if you want to continue at that level, right? If you want to continue to enjoy that activity,
right?
It's just the laws of nature, right? So stress it, you're going to have to do some upkeep in order to maintain that lifestyle that you're looking. Otherwise, either do that or just give up the sport altogether, if you're okay with that.
Right.
But a lot of people don't want to.
And I have one more thing to add, and then you take the rest. Even if you do end up getting a knee replacement, or if you've gotten a knee replacement and you're dealing with a lot of pain, because there's a lot of inflammation and pain that accompanies after getting a knee replacement. I mean, the knee looks like a balloon,
Right.
But even if that happens, we you and I both, Dad, we've both seen many patients who have had knee replacements, and the job is much harder. They take 3 times the amount of work. It takes 3 times the amount of work to take care of someone with a knee replacement. However, it's the same principle for those who stay steady with coming in for the treatments. Even with a knee replacement, we've seen great improvement. And I think in the case of that one patient who walked in, who had both knees replaced, it took him about a year of continual care at the office, right? But a year later, by the grace of God, he was able to get back into working out pain-free. To this day, no pain in his knees, but it just took 3 times as long.
Yeah.
So,
I think about a patient came to me, he had a knee replacement. It was still painful after his knee replacement. And he came to see me because he still had chronic pain in that knee. And I told him after doing our exam, it's going to be about 36 visits before this really starts to feel, like we're getting to the results that you want to get. And he felt immediate relief, but he kept at it. He wasn't where the level where he wanted to be. And it was just like a month or two ago, he said, after like 6 months of care or so, he's like, I feel like I'm turning a corner here. And now it's like, it's just amazing. Sometimes they hit a plateau, it seems like, and you keep working at it. And then one day, boom, they just like feel that much better. And they're like, okay, I can see how the perseverance has paid off in this. And now he's doing a lot better and he's happy and he's continuing on. But you're right. When they've had that knee, just because you have that knee replacement, you're still going to need care because you have the other knee that has not been that is you want to keep from preventing that from happening. And there's even upkeep on the knee that had the knee replacement, right? There's scar tissue that forms in that area. And there's sometimes, these people, well, that's not an end all be all that you're not going to have any more tightness or pain or lack of range of motion. No, that still needs to function at its best if you want to be able to do the things. And this gentleman loves to work in the garden, and so anyway, good point. Lots of good stuff here. We can continue talking for the next 2 hours or so. We like to keep these shows to half an hour or so, but
very good.
One thing I do want to mention is that if you're wanting to know more, this is a great book, Overcome Your Knee Pain: 7 Principles for Avoiding and Recovering from Knee Pain, written by Dr. Hudson Taylor and myself, Derek Taylor. It's a great book and some good principles on this. You can pick this up on Amazon. But we're pretty passionate about the knee. We love to see the results that happen, and I hope this show will be a benefit to people that are dealing with knee pain and giving some insight on what they can do to help avoid the knee pain. And just one thing that I would want to mention, just strengthening those quads and looking at those quads. If you're getting things worked on, don't neglect the quadriceps because they pull so much in the knees. So keeping those strong and loose and scar tissue free can make a big difference for the knee. And wearing the right shoes, staying balanced, staying adjusted, all of these things, the more balanced you are, the less knee pain you'll have. So
absolutely. Great words. Words.
Anyway, this has been Dr. Derek Taylor with Dr. Hudson Taylor for the Taylor Method for Pain-Free Living. We've been talking about overcoming your knee pain. And we hope this show has been beneficial, and we look forward to seeing you on the next show. We are signing off.
Bye-bye.
Thank you for listening to the Taylor Method for Pain-Free Living podcast. For more information about the Taylor Method and how you can find lasting pain relief, visit www.drderektaylor.com. That's www.drderektaylor.com.